Welcome back to Body Beautiful. Right now we're talking about breasts with Dr. Lee. We're talking about breast and plastic surgeries, and we're taking your calls. It looks like they're already streaming in. Any questions you have about breast surgeries or even plastic surgery in general, the phone number here, 800-440-4884. We'll also be posting the number for Dr. Lee's office during and at the end of the segment. Remember any advice we give you today. Always get a second opinion. Another really important thing, we can't stress this enough. A lot of people can do surgeries, and certainly breast augmentation, very popular. You need to be careful.
You do. I think it's very important to know for the public that that there is different training, and that people who are certified by the American Board of Plastic Surgery have been trained in breast surgery. And that's not to say that other surgeons can't do breast surgery, and I don't mean breast cancer surgery, I mean augmentation and reconstruction. But it's important to know what your surgeon's training is. And one way that you can figure things out, because there's a lot of things that are misleading out there, is to ask your surgeon, particularly if they have their own office OR, if they have privileges to do this procedure in a hospital facility.
And why is that important?
Because a hospital will only allow you to do procedures for which you have received postgraduate training. Okay. And if you build your own operating room in the state of California, you have to do, actually anywhere in the country, you have to do 1 year of medical training after graduating from medical school, and you receive a certificate that says certified to perform medicine and surgery.
Basically, you want the best.
You want to know that the training is
the one body you're given.
That's right.
All right, let's go ahead and show some photographs very quickly here, because we're running out of time, and I promise we take some phone calls here.
Well, so this is a picture, and we've unfortunately marked out the nipples, but this is a picture of a patient who had breast augmentation surgery, and you can see that this is a typical breast after you've nursed. There's loss of fullness in the higher aspect of the breast, the superior pole, and she's got a little bit of droopiness in that the nipple is right at the crease underneath the breast.
I'm sure she's very happy in a bathing suit.
She was very happy in a bathing suit.
Okay.
Yeah, and this is the same view, but this is the front view.
Okay. And do we have any others really quickly before I jump into these phone calls?
And this is also another patient who was always small-breasted and liked the way she was when she was nursing and wanted to go back to that kind of fullness. And she's very athletic, so she did not want anything that was very large, so that it didn't interfere with her activities.
Well, that's beautiful,
jogging.
very balanced. Okay.
Thank you.
Do we have another one, or can we jump into these phone calls here? Okay, one more. Okay, this
is a breast lift procedure. So what you can see is that those little marks are over the nipples, which are down at the base of the breast, and we've reconstructed the breast mound as well as taking out extra skin and moving the nipple up.
Beautiful. Can we go ahead and jump into our phone calls? Okay, we got one more here.
And this is, I believe, the side view of the patient from before.
All right, let's go ahead and take some calls. Deanna from San Leandro, do you have a real quick question for the doctor?
Yes, I do. I have pulmonary hypertension, but I was wondering, how do you go about finding out if you have, like you wanted to get a
if you're safe to have a breast reduction?
Exactly.
Okay. Well, I would need to speak with your pulmonologist to find out what kind of needs you might have for special care during the surgery. But my initial feeling would be that if your breasts were interfering with your breathing, which they might be if they're really large, that this might actually be to your benefit, but we'd have to take very special care to assess you preoperatively.
Thank you, Deanna. Let's move on to Christina from San Jose. I'm sorry, but I want to get these calls in. We have about a minute left. Christina, really quick question?
Yes, I wanted to know, I had a breast augmentation done, and about a year later they dropped, and it kind of looked like that last picture she showed. And my question is, could you have them redone again?
Absolutely.
Also, my doctor that I went back to him, and he kind of put it off past 3 years of statute of limitations. And so I really don't want to go back to him. And my question is a lot of people, my friends are saying they should just charge you for anesthesia and not to redo them and relift them again. And he just did not agree with that at all. So he wanted to charge $4,000 again. And
right. You know, it's a difficult situation, and a lot of it depends on what the particular physician wants to do. Unfortunately, with aesthetic surgery, sometimes you do get involved in something where you feel like you've paid for what you didn't get. And again, that varies from physician to physician.
Okay, thank you very much, Christina. I'm sorry. I apologize to all the people that the calls we couldn't take. Obviously, we're going to have you back. Interesting topic. For more information about Dr. Lee, call her directly, 510-704-2170, or check her out on the web at artfulsurgery.com. Thank you so much, Dr. Lee.
Thank you for having me.